Hello, everyone, and thank you for joining us this evening for the 8th week of the RISE Institute and Rugby Research and Injury Prevention Group 2026 Summer Lecture Series. My name is Isabella. I am a rising senior attending Downey High School from Downey, California, and I am a 2026 RISE intern, and I am currently looking into physiatry. We have already done introductions, so we're going to start tonight with our featured speaker, Dr. Monique Mokha. Dr. Mokha is the Exercise and Sports Science Professor in the Health and Human Performance Department at Nova Southeastern University. Dr. Mokha, could you please share a bit about your background and give a brief introduction about what you'll be teaching us about today?
Sure. Well, thank you for saying my name so nicely, appropriately. I get a lot of versions of it. So yes, I am a full professor here at Nova Southeastern University in exercise and sports science. My background, I started out clinically. So as a certified athletic trainer. So I worked on the field, the person who runs out on the field and initially takes care of the injuries with, the physician on your heels. And does a rehabilitation, pre-participation exams, and really sweats right along with the athletes. And then I got a really keen interest in biomechanics, so how things work, and earned my master's degree. I also was still working as an athletic trainer at that time, and then my PhD in biomechanics. So I sort of, at the time, educated myself out of a clinical role and found myself being more like, okay, I'm going to study sport injury and sport performance and having I believe anyway, a great relationship and connection with university athletes and athletics. So that's kind of my academic background and where I am now, merging those two, like clinical field with the scientific part of it.
Perfect. Thank you.
So one of your questions that I didn't answer was, what will you be talking to us about today? So this is the topic, and you can see, of course, my affiliation. So I'm way down here in Fort Lauderdale right now. I'm not sure if any of you are in the area, but I believe you guys in the Northeast are having hotter weather than we are down here. And this is the paper. So this was the paper that I sent, and I thought this might be a really good one to bridge so the sports medicine part, which I'm sure you all are interested in, medical part, and then for me, it's got a lot of hardcore mathematical science in it. Not this is going to be a math lesson, but I think that should pique some interest, sounds like, from what you guys have discussed about yourselves. So this is the particular paper. Okay. So you just want me to kind of roll through things, or is that appropriate? Just kind of roll through. Okay.
Yes.
Thank you. And I am a professor, so I'm used to teaching and I'm used to being politely interrupted, when someone has a question. So I don't mind that. Of course, I can't see everyone right now because I have the screen small. But if you have a question or you'd like me to explain something further along the way, I see it as a compliment and not an interruption. So feel free to unmute and ask me if that's okay with the rest of you. Okay. Well, again, this is the paper, so morphology. And what I really mean by this is, how the size of players and their composition. So maybe a better title would have been body composition, but that's what I'm looking at rather than taking like the circumference of their arms or anything like that. And then the knee joint, you know what that is, but kinetics are loads, forces. We can generate loads and we can absorb loads, so it's internal and external. And this cohort was pretty special. And I'm lucky, well, it's more than lucky, forge relationships, right? But that since 2018, we've been doing pre and post tests for NFL draft prep players. So they're players that come to South Florida and they're enrolled in a specialized, it's kind of like, you get ready to take your ACT, SAT type of thing, and you bone up on it. You do like, I get to train for the test. That's what these guys do. And it's usually a 6 to 7 week camp. So we don't run the camp, we run the sports science. So these are the players. And then implications for OA, because I'm going to share with you some alarming statistics that are also in that paper. So I'm sure you're familiar with American football, but at the same time, I wanted to highlight, you may recognize or not, perhaps Dr. Lopez and I, but Joe Namath and Earl Campbell, one is lighter, he was a former quarterback, one is heavier, is a running back. Both have had bilateral knee replacements after their playing days. And outcomes like these in American football players are common, unfortunately. In fact, retired players over 50 are 10 times more likely to have had hip or knee replacement than any other professional retired player. So we've just come off of, the World Cup, Men's World Cup, and so we're thinking about soccer perhaps, but so they're 10 times more likely even than those players after they retire. And again, since we're shifting football here, what we think about in American football, I thought I'd just remind us of some of the basics. The game combines intelligence, skill, strength, physicality, explosiveness, and you can see that in those, the GIFs there performed by players in different positions, whether they're running the ball as a wide receiver or you see some linemen there. Most of the players are larger than other team sport athletes, including rugby players and Australian rules football players. So, but certainly some positions demand a smaller or larger body size based on what they do. So American football players are subject as well to some unique health concerns that can cause pain and long-term disability. And one such impairment, of course, is osteoarthritis. So here are some statistics for us as well. OA is more prevalent in retired players, in retired American football players than in the general population. And so you think about, general population, maybe many of you know people or, you have older people in your family or in your city block or in your building, and they've said, oh, my arthritis or oh, my osteoarthritis. And you kind of get an idea that it's pretty prevalent, but more in retired American football players. And knee osteoarthritis, the topic for today, is more common in your linemen. So you see a really large lineman over there, and should you so want to sneak your phone out, you can quickly change those kilograms to pounds and be like, holy cow, this is a heavy individual. Well, heavy or size is prized in American football players. In fact, if you think about how colleges recruit, they want to recruit larger athletes, and then they even develop programs nutrition-wise, strength and conditioning-wise, to put more weight on them. Functional weight, of course. So not always just heavy to be heavy, but sidebar from this slide right now, we had a player from the University of Florida test 2 years ago on our treadmill, and he was 475 pounds. That's a large and heavy individual. Well, you can see as many as 97% of them are categorized as overweight, so that would be a BMI above 25, and 56% as obese, and that would be a BMI above 30%. Above 30, sorry. Now, if you do, some of you are health sciences and you may have talked about BMI in your classes, we all know that BMI is not the greatest for athletes because they do have a lot of lean muscle mass that makes them pretty darn heavy. Well, overweight and obesity they're potent risk factors for the development and progression of osteoarthritis. So I hope you can start to see how I'm putting some pieces here together and why, yeah, this is a small group of people in the world, but it's a huge problem for them. So let's get into the biomechanics a little bit. Morphology combined with these biomechanical factors, such as sensitivity of cartilage to high impact versus low sustained loads, high what are called vertical ground reaction forces. And I'll pause for just a minute because you can maybe surmise from the term, vertical ground reaction. So vertical is up and down. That's going to be their impact when they hit. So when you hit the ground, remember Newton's third law, action reaction. So when you hit the ground, you get a force equal and opposite in magnitude and directions coming right back at you. So if you are bigger and heavier, you can apply typically an absolutely larger force down. Back to the slides. Then they also will have the larger, higher joint reaction forces and moments. Now, a moment, I might need to stop here, is not just 60 seconds, right? A moment is, think of inside of a joint, it's a rotational force, like a torque. So it's a rotational force at the knee or hip. We're going to talk about the knee, so we'll keep it there, okay? So these moments, these particular biomechanics will play a role in the development and progression of osteoarthritis. Well, I also wanted to consider the longevity of loading. So many of these players have been playing, Pop Warner or Pee Wee football, since they were children, if not at least since, middle school, early high school. So that's cumulative loads, right? And we've seen in children with increased body weight that's associated with some of these deleterious biomechanics, larger forces and joint moments. So I would argue as well that learning more about osteoarthritis development in these players, it's a public health issue. And studies have been sparse. In fact, there was a call to action. So this is really cool. This group out of Harvard, the Harvard football study is actually very straightforward is what they call themselves. It's the Harvard football study. And they put out a call to action to address the prevalence of hip and knee replacements in former players. So this piqued our interest, my interest specifically in leading to what can be considered, I would say, the first step into utilizing biomechanical research prospectively with this population. So this study's purpose, we want to just start basic and see, is there a relationship between these body composition factors and kinetics that are associated with NOCSAE, like those moments, vertical ground reaction forces, joint reaction forces. So would there be an association in this elite group that is predisposed? So I'll go through our methods a bit. And we had 125 players, and these are from over 3 years. So they didn't all come in the lab at the same time. Sometimes we have players come in the lab and they can't run to, like that 475-pound young man, he couldn't run to the minimum that we wanted it to be for research purpose. So we give the performance coach and the sports medicine professionals feedback, but we don't use that one in our data. So we test anywhere from 80 to 100 players every January and February as they, prep for their tryout. Anyhow, so 125 of them made the inclusion criteria. You can see their ages, they're pretty large. Look at those masses, and that does include your lighter players, of course, but these are heavy people, these are bigger people. The equipment that we use is a motion capture system, and I'm going to show you, I have a little video that I've embedded so that you can, if you're a visual learner, it could really help. And they went on an instrumented treadmill, and when we measured their body compositions, we used bioelectrical impedance. You probably have used bioelectrical impedance at home, meaning if your home has just like a little scale that you stand on and you're supposed to be barefoot, has silver things that you stand on, and it sends that, you don't feel it, but it sends that electrical wave through your body. That's what we used, but a fancier one, like thousands of dollars fancier, and more accurate. So we use, that's what bioelectrical impedance. Procedures, just walk you through. They came in, they got that bioelectrical impedance done. We took a whole bunch of measures from them, like head to toe measurements from them. They did a standardized warm up. In fact, the performance center, where we send results, they sent one of their coaches. So that would be the same, for all 125 of these players had the same exact standardized warm up, which makes it fabulous for research purposes. We then put markers on them, and you'll be able to see when I show you the little video. And the markers have to go specific spots based on the system that you're using. So the brand and the model that you're using. And then we sent them over to the treadmill. So let me show you a little bit of this, and we don't really need the sound. So this is our lab. And first what he's doing is, they have to be scantily clad because you have to be able to see all of those dots. And they just finished having their body composition assessed and warmed up and everything. So this is our pretty cool lab. We're using, it's called the Vicon system. And so some of you, I'm not sure if you've seen motion capture this way. It is the same type of system that would be used to make video games. Or to make, if you're a Lord of the Rings, I know that's a little older, but if you're a Lord of the Rings fan, how they made Gollum. So let's see, I'm going to forward this just a little bit here, but I'm doing some things with the computer. And then we're going through the protocol here. So as you can see, this treadmill is called a split belt treadmill, and it's really cool and very expensive. It has force plates in it, so transducers. That when they're compressed, they send an electrical signal to our system, and that the volts get converted to newtons. And you probably already know that newtons are a measurement of force. So I'm trying to give him a whole bunch of information for his safety and what the protocol is going to be like and such. And he doesn't actually go all the way up in our speed, but let me fast forward him so you can just, what it looks like to run. But here's a decent size individual, doing it's not high speed run because he didn't go all the way up to the 14.5 miles per hour, but you can see the process. The cameras are in the background, you see on the wall. And so they're filming his markers. They don't film him. They don't film images, only markers. I will share with you that we had one player since 2018, and he was in this group with this gentleman here. One player slip on the treadmill when he was at high speed, yeah, and he fell. Thank goodness, a lot of thank goodnesses, he did not injure himself other than an abrasion on his shin, which as certified athletic trainer, I immediately took care of, called the coach, and just to make sure that everyone knew what was going on. So he was fine. He's playing in the NFL now. So he has scars from our lab on his shin. Since that time, then we're put a harness on them that's hooked to the ceiling. So, okay. So these are just a couple photos that show you a bit of some of the collections through, through that particular year, some different vantage points. You can see how we set up all the markers on the lower part. The lower right, my student there, Maria, she was like, you need to show how chaotic check-in is, because she has all the papers and consent forms and things like that. Because, for research, of course, we're making sure they provide their written consent to be in the study. Okay. Guys doing all right? Okay, perfect. So just, again, stop me. All right. So these were the variables then that we tested. So we grabbed what their total body mass was, how much muscle that they had, and then their percentage proportion of fat. On the right-hand side were the joint kinetics and the overall. So ground reaction forces, remember that's GRF, ground reaction forces, And you can see our units of measure there. And I'm not anticipating that you tuned out, but this is like an extra tune in because it's a crux of the study. You'll see newtons per kilogram, and that means these are called normalized forces. They're normalized to that athlete's body mass. And the reason that we would do that may be obvious, but just humor me. We could have one of you who is very slight in stature. You know, maybe you're 5'4" and 125 pounds. And then you could have someone else who's, 6'2" and 220. Okay. And they could actually produce the same amount of overall force. Let's just say they both produced, 600 newtons of force. Well, that's going to be a bigger deal for your smaller person because that's a lot of force for their smaller stature, sorry. So that's why we called this normalized force, and it ends up being a big deal for us at the end. Okay, so let's get into some of the results. These were the mean results for our body mass, and you saw that earlier, that they were around 101.4 kilograms, which is still pretty heavy. It does include your lighter folks as well, and a pretty good amount of lean muscle mass. And maybe you're surprised, I don't know. You look at that gentleman you saw on there, and maybe you're in some of the ones in the picture, and you may have thought they were really high in body fat, but at least the mean was 13.3% body fat. So they are heavy, heavy with muscle for sure. So only 5.5% had above 30% body fat, which is pretty low. And then those kinetics, so the forces or loads on the body, we did this for both left side and the right side. So their vertical ground reaction force, how hard they were hitting with each step, that's 18.3 newtons per 1 kilogram of body mass. So that's not extremely high or anything. It just gives you an idea of how to think about it. Notice though that that's overall force, but notice when you go up to the knee, it gets larger, 25.1. Yeah, so our players were pretty symmetrical, as you can see, in their loadings, but just gives us, again, a little foundation of what the variables mean. And then here's the part, the statistics part. So when I flip the slide, you're probably aware that an association or a correlation just means does one variable go up when the other one goes up? Or does one variable go up while the other one goes down? So how are they related that way? It doesn't tell you differences. It just gives you, do they both move in the same direction at the same time or opposite directions at the same time? So that's what we wanted to look at. So this is just the force. So, and again, excuse me, I don't want to talk down to anyone who already is a stellar graph reader. But whenever we approach a graph, it's a good idea to get oriented and say, what's on the vertical, right? What's on the y-axis? This is force, that ground reaction force. What's on the horizontal? And you see we have 3 different ones of those. The first one was their total body mass. And so there is an association here. And if I were teaching, I'd say, what is the association? Isabella, can you explain? But I won't call you out, Isabella. So if you notice then, as total body mass gets larger, right? Like as we're moving down the right-hand side to the right on that bottom axis, that bottom line, you can see that force comes down. And that's where I asked you earlier to tune in a bit about normalized force. Because yes, the heavier I am, I can produce more force. But when you normalize it and compare me to all you guys, we have a different result. So the heavier that they were, they dampened that vertical ground reaction force. It went down. And that's the same thing that we see as you move across with lean body mass. So more lean body mass, that vertical ground reaction force went down. And it's the same thing with body fat, although that association is not very strong with body fat. So far, it's like, the heavier you are, then the lower that normalized vertical ground reaction force is. So we'll go to the knee because that's interesting as well. And we see the same thing. So as mass, whether it's total body or how much muscle they have, the more of that they have, then the lower those normalized forces are at their knee. And that's just strange. And so body fat also has a statistical association, but it's very weak. So I won't talk a lot about the whole body fat thing. It just really seems to be the heavier that they are. So let's see. We were asked by our original submission, we hadn't done this. So we submitted the article for consideration and they asked us, they said, hey, well, can you do some sort of split pot? Can you divide your players somehow so that we can run just a basic t-test to see if they're the heavier ones were different? So rather than just correlation, could you see differences? So we're getting oriented. And we see that blue are our heavier players and red are lighter players. So across the board, I'm like, red bars are higher and blue bars are lower, and the blue bars are the heavy guys. And so if you wondered, what you can see on the slide, but how did you determine who was heavy and who was light? We just lined up all the 125 masses here and joint forces and such, and use that 94.5. It was the median score. So everyone above it was heavy, everyone below it was light. And so there are differences. So these heavier players are doing something. They're doing something different. So let me bring these on then. The normalized kinetics, those are the forces, inversely related, right? Heavier players, they were dampening, and that's the nice word that we use, right? They're mitigating or dampening the forces somehow, even though with the naked eye, they look similar in terms of their running mechanics. It's not like one did some little skip-de-doo or ran more on their toe or nothing like that. The associations that we found, like the stats, the numbers wise, were higher, stronger, I should say, for masses than they were for the body fat, which I mentioned earlier. Let's see. Then we were we were looking into previous research. There's been nothing with football players like this, so we didn't have anything to compare. But we did find an article, Heather Vincent from the University of Florida, where she looked at recreational runners. So they weren't running at the speeds that our players were, but recreational runners, and they saw that obese runners dampened or had those, they were associated with lowering that vertical ground reaction force, the impact loads. We also had a pilot study that we did, and you can imagine a pilot study being called that with 55 players, but we did see a similar dampening in a similar cohort out of our lab as well. So we're just not totally sure what's going on here, sports fans. So is this dampening, because it's totally unexpected, is this dampening a training effect or something that they've learned through years of playing, how to mitigate loads at their knee, at least in acute situations? Well, one thing that we thought about, we're scratching our heads and we're like, well, we didn't look at originally we're just looking at the forces, right? So we thought, wait a minute, if you bend your knee more, that's one way that you can dampen your loads. Think about it, you guys, landing from a jump. If you land straight leg, I mean, the forces are like, it's painful. You're like, ow, you're not going to do that. But if you land and bend your knees, it feels better. That means you dampened those loads. So we thought, I wonder if their knee flexion angles, the heavier players, were, they bent their knees a little bit more. That would look funny if they bent them a lot because they still have to be efficient running. But we looked at the angles. They were roughly 34 degrees, which is similar to that in sprinters. So it doesn't appear that that was the reason. Now, something else, greater muscle mass and potentially strength, so this greater mass also can equate to strength like that. We're thinking maybe that offloaded, where it offloaded the force from the joint itself and really provides impetus for a study we're working on now, which is trying to get the muscle contributions to this, not just what the loads are in the joint, but what are the muscles doing as well? Are they offloading, etc.? Because short-term loads appears that there can be offloaded, but the cumulative compensations, as you can see the last bullet point there, are unknown. And that really, I think, provokes continued study and more longitudinal monitoring. So speaking of, what I really want to do is, I don't say former, but former clinical athletic trainer. So yeah, I don't practice anymore. I'm not running out on the field, but man, I mean, I care about these players. I know you care about your future patients and athletes that you may be working with. And so I really want to contribute to this and try to help figure out, can we track them longitudinally during their careers? And our lab is uniquely positioned to do this. I don't know if you caught it, but at the start, I said that, since 2018, we've been bringing these players in that are draft prepping. Well, when they do well with this guy who trains them, they come back in the off season and train with him. And we've had a few of them come back in the lab. And you know what's interesting? It's only an N of 3, but all 3 of them, even when you normalize for their mass, so a couple of them gained some kilos in the league, like these are the guys who made it into the NFL, and so 3 of them have come back to the lab, their knee joint forces are elevated. They're higher than they were the year they were drafted. And it's like, well, what happened? So I think this is something that can make a really big deal in their longitudinal health. Certainly, we would want additional data, and maybe you're thinking along those lines too. Anything from limb alignment. We don't have, I could have gotten them at the time, but this was a retrospective study. Get some histories on how many meniscal surgeries have you had? Have you had your ACL, torn or replaced, that kind of thing? Because Dr. Lopez, many of you obviously know that that can increase someone's risk of getting osteoarthritis. Maybe we could measure some of the biochemical markers, even if it's just a simple saliva test. Cartilage changes, so musculoskeletal ultrasound or something, functional MRI, something where we can even get changes in what's happening at the cartilage level so that we can quantify the loads, maybe get into some of their maneuvers. All I did was running. Can we possibly measure this during other types of football specific maneuvers? Look at them by position. I do a lot of research like that already where I have them grouped. So again, I don't want to, if you're huge football fans, you're going to like, oh, I already know this, but we call them bigs because they really are, and they're the linemen. And then you have your skill players at the opposite end. And those, of course, are like your defensive backs, your wide receivers. And then you have like hybrid players. They're called big skill, which would be more like your tight ends. Quarterbacks are in that one as well. So maybe we look at by position because that tends to pan out morphologically as well. So I grabbed this, Angelica. So I grabbed this idea, and these are lofty, and maybe you guys have thoughts on how we could do these. While we can't say for sure, because I'm a researcher, so I am not willing to say that if I improve movement efficiency, that will lower their risk of OA. I'd need to see the studies, right? But I think these are ways that the sports medicine team, so I thank you for coming up with them, can come together to try to mitigate the risk for sure and keep up with someone like me or others, who do this type of stuff with that hardcore biomechanics so that we can measure, get some internal loads and what's going on. I hope that helped a little bit. I'm going to go ahead and pause it or stop it there. I think I have an official conclusion to the study, but you've probably gotten it by now.
Okay, thank you so much, Dr. Mokha, for that excellent presentation. Thank you so much, Dr. Mokha, on behalf of all of us. You're so sweet and so informative, and your lecture was very enriching. And that will conclude the week 8 of the RISE Institute in Rugby Research and Injury Prevention Summer Lecture Series. And once again, we would love to give a big thanks to Dr. Mokha for joining us today and everyone in the audience in attendance. Thank you all for attending.
Great.